Namaste JVM. Myself JVM Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at Jyoti Vidyapith Women's University, Jaipur. In this session, we are going to discuss about practice of medicine. We are going to discuss about the subject practice of medicine, which is being taught in BHMS 3rd year and 4th year. So, what is practice of medicine? How it is taught? What are the topics that will be covered? What will be the duration of the sessions? All these things we are going to discuss in this introductory lecture. So, let us start with practice of medicine. What is this subject? What we are going to study in this particular subject? In which year, what are the topics will be covered? All these things we are going to discuss today in a summarized way. So, let us start with it. Practice of medicine. This is a subject which is taught in 2 years in BHMS. In BHMS 3rd year and in BHMS 4th year. 3rd year and 4th year. But the exam occurs in BHMS 4th year. After the completion of 4th year, the student is giving the exams. There are 2 papers of practice of medicine. The course that will be covered in BHMS 3rd year will be asked in paper 1, and the course that will be covered in BHMS 4th year will be asked in paper 2. So in this way, the papers will be there. Now, what is the objective of this particular subject? This we have discussed. The examination will be conducted at the end of BHMS 4th year. Now, after studying this subject, a homeopathic physician, a homeopathic student will be able to comprehend the practical aspect of the medicine. The physician will be able to understand what is the practical aspect of medicine. What is medicine? The knowledge about various diseases. We are going to understand the practical aspect of all the diseases, and we will be able to apply the knowledge of those diseases on the patients who are coming to us. The physician will be a trained clinician with the ability to differentiate sharp observations. The student is going to develop sharp observations, and there will be conceptual clarity about the disease process. How the disease process is going on, we will be able to make a conceptual clarity. We are going to develop various concepts by which we can identify about the disease process by taking help of the latest diagnostic techniques. We will be able to take the help of various diagnostic techniques available for the diagnosis of disease, like X-rays, like ultrasound. After studying this subject, the student will be able to understand different type of X-rays, different type of ultrasound studies, electrocardiogram, and the commonly performed laboratory investigations. Whatever laboratory investigations we are advising the patient for the diagnosis of the disease, after reading this subject, the student will be able to learn all the clinical and practical aspect of this disease condition. After this subject, the student will be able to do the rational assessment of the prognosis. Prognosis means telling the future course of the disease condition, and the general management. General management of the different disease conditions are also focused. So the student will not only be able to know about the disease condition, but also be able to distinguish different disease conditions having the similar clinical presentations. So a student will be able to know about all these things. He will be able to understand the practical aspect of the knowledge for the diagnosis of different disease conditions by using various diagnostic techniques like ultrasound, X-rays, electrocardiogram, and various other hematological investigations. The student will not only be able to know the disease condition, but also be able to differentiate the disease conditions with the related disease conditions, that is known as differential diagnosis. So after this subject, the student will be able to know about all these things. Now, what is the syllabus? As we have discussed, the course will be conducted in 2 years, BHMS 3rd year and BHMS 4th year. So what will be covered in BHMS 3rd year? In BHMS 3rd year, in both the years, the student has to apply the anatomy and physiology. The knowledge of anatomy and physiology is must. That is covered in BHMS 1st year. So, as we know that the student is coming in 3rd year and then studying this subject, so it is understood that the student is well aware about the anatomy and physiology of the respective system. So, first of all, you have to go through the anatomy and physiology of the respective system that we are going to study. So in the third year, we are having three major systems. We are having three major systems that includes the respiratory system, digestive system and hepatobiliary system, and genetic factors. So these are the three major systems that we are going to study in BHMS third year. The course duration of BHMS third year will be of 75 hours. These topics will be covered in practice of medicine and homeopathic therapeutics. The course of the third year will be of 75 hours, out of which 50 hours will be related to the disease itself and 25 hours will be given to the homeopathic therapeutics. Now what are homeopathic therapeutics? Homeopathic therapeutics is the knowledge of the homeopathic medicines that are given in the disease condition, in a particular disease condition. So out of these 75 hours that we are going to give in BHMS third year, 50 hours will be related to the disease itself and 25 hours will be given to the homeopathic therapeutics. Now, what are the topics that will be covered in BHMS third year? In the BHMS third year, number one, we will be starting with the various respiratory diseases. The disease conditions related to the respiratory system like bronchial asthma, tuberculosis, pneumonia, bronchiectasis and so on. The knowledge of all these disease conditions will be learned in BHMS third year along with homeopathic therapeutics. Then, after the completion of respiratory system, we will be switching on to the next system. In the next system, we will be studying about the diseases of the digestive system and the peritoneum. Digestion is a normal process and a normal physiology. If the digestion is disturbed, then what are the common disease conditions that can occur in the digestive system? This we are going to learn in this particular chapter. We will be covering various disease conditions like dyspepsia, vomiting, constipation, diarrhea, inflammatory bowel disease, irritable bowel syndrome and so on. All these diseases will be covered under this particular digestive system and peritoneum related diseases. After the completion of this particular chapter, we will be switching on to various diseases related to the hepatobiliary system. Hepatobiliary system. Now, hepato means pertaining to liver and gallbladder. So, in this particular chapter, we are going to learn various diseases related to the liver, like hepatitis, like cirrhosis of the liver, and so on. Disease related to the gallbladder, like cholelithiasis, that is gallbladder stone, and diseases related to pancreas, like pancreatitis, both acute and chronic pancreatitis, pancreatic carcinomas, we are going to learn in this particular chapter. So we will not only be learning about the various disease conditions, but also be learning about various carcinomas. Carcinomas or the malignant conditions, this will also be covered in these chapters. After completion of these chapters, like respiratory diseases related to the respiratory system, diseases related to the liver, gallbladder and pancreas, we will be moving ahead with the genetic factors, diseases related to the genetic factors, various genetic genes related diseases, and in homeopathy we call it miasm. So we will be understanding or we will be learning various diseases related to the genetic factors. Various genes related diseases will be covered in this particular chapter, and we will be comparing these genetic diseases with the homeopathic concept that is known as genetic miasm or chronic miasm. After this, various immunological factors. We will also be learning about various immunological factors that are responsible for the disease conditions. Like we will be learning about the immunity, how the immunity is responsible for the prevention of disease condition. We will be learning about different types of immunities, active immunity and passive immunity. We will also be learning about various immunoglobulins that are associated with the disease condition. And this we will be comparing with the susceptibility of the patient. Susceptibility is again a homeopathic concept which we will be learning to relate with the immunological factors, how the immunological factors are related to the susceptibility of the patient and ultimately leading to the development of disease condition. In this we will also be learning about hepatitis B and HIV virus, human immunodeficiency virus and hepatitis B virus. We will also be covering in this particular topic itself. Next we will be learning about the disorders due to chemical and physical agents. These are the diseases related to the environmental factors and the internal environment of the both external and internal environment of the body. Disorders that are related to the chemical and physical agents in the body and outside the body, and also related to the climatic environmental factors. So all the diseases that are related to the environmental factors and also the deficiency of the minerals we will be covering in this particular chapter. And at the end, after the completion of disorders related to the old age population, like we will be discussing about falls, we will be discussing about delirium and so on. So this was all about the topics we will be covering in BHMS 4th year. We will also be learning about the applied anatomy and physiology that I have just told you. That is common in both 3rd year and 4th year. We are going to discuss about the anatomy and the physiology and different organs and systems related to the specific diseases. Apart from this, the clinical examination of all these systems that we have discussed will also be given importance to, but this examination is mainly done in the hospital or the OPD setup, and this is not possible with this PTO setting. So in the BHMS 4th year, we will be discussing about the duration of this course is 180 hours. We will be discussing about various nutritional and metabolic disorders. We will be discussing about disease of the hemopoietic system, that is related to the blood and its components, endocrinal diseases, the diseases related to the hormonal system, infectious diseases and tropical diseases, that are various infections that is commonly affecting human individuals, diseases related to the cardiovascular system, that is heart and its components, urogenital tract related to the kidneys and its appendages, diseases related to the central nervous system, peripheral nervous system and psychiatric disorders. These will be studied together, and diseases of the locomotor system that I have just told you, like especially arthritis, ankylosing spondylitis, etc. Related to the skin and sexually transmitted diseases, tropical diseases along with infectious disease, diseases of the children, that is known as pediatric disease, and diseases of the old age, that is known as geriatric diseases. So these are the topics that will be covered in this particular subject. I hope you must have understood the framework of the topics that we are going to discuss one by one, and then we will be starting with the respiratory disease first. That is the topic of the BHMS 3rd year. So this was all for today. I hope you must have understood the session properly. Thank you very much.